Deputy Education Minister Dr. Duchum says surveillance is ongoing at the Accra Girls Senior High School to ensure students are safe.
Ghana Health Service, in conjunction with Ghana Education Service, have gone through several routines, meetings, establishing protocols, ensuring that everyone was prepared. The various logistics were provided by the government, face masks, Veronica buckets, sanitizers, everything that needs to be provided has been provided in our various schools so that the children will be safe. So far at the tertiary level, we haven't had much of what you compare to what we saw at Accra Girls. Accra Girls High School, a very distinguished school in Accra, 7 young women. On June 29th, a case was reported to the health bay, a student who was unwell. Of course, they quickly identified that it might be a symptom of COVID-19. Student was immediately isolated. Subsequently, other students were having similar symptoms and they were all quickly quarantined. To really use the medical terminology, I hear there's a difference between quarantine and self-isolation and isolation. So the students were quarantined prior to the testing. And as I speak with you, the test results came in and we had 6 students who tested, unfortunately, positive for COVID-19. They were immediately isolated and taken care of, parents informed to ensure that we can bring down the anxiety. I can understand a parent getting a call from school saying that your child is not well and it's COVID-19. The frustration will be to the highest level possible. And I can understand why other parents will also run to the school and say, can I take my child away? But taking your child away at this point is not a very good option. The school has isolated 648 contacts. And it's not just 6 students. There was an instructor and the wife who has also been isolated. So you know you have 8 students from the school community. At this point, the 648 contacts have been identified. A number of them have been tested. The Ghana Health Service took a team, worked with a team of 200 in looking at everything that needs to be done, that has to be done. And as I speak with you, they're on top of the medical side of things. And the Ghana Education Service is also looking at the education side of things. We understand that in the midst of all the anxiety, it's difficult for students to even learn. But counselors are on site now, looking at ways that they can help the students recompose themselves and begin to take a look at the preparation that is ahead of them. At this point, what we want parents to understand is that everything possible is being done to make sure the safety of the children is protected, that the children are not in harm's way, and that anything that the Ghana Health Service has to do is being expedited, is being done in a way that is different from what is even done in the general community, because they know these are children who are in school, whose parents have entrusted them to our care, and we need to make sure that they are safe. The school has 701 final year students and 459 second-year gold track students. The gold track students were those who had to be in school because at the time of the school closure, they had not spent enough time in school to catch up with those that were on green track. So they were called back to school together with the final year students. The Ghana Health Service, the Ghana Education Service conducted a joint inspection of the school. They have access to continue to heighten the awareness in terms of physical distancing, in terms of the number of students that can eat at the dining hall at the same time. They have asked that we continue to ensure that the protocols are observed at the school as they deal with the students who have been isolated and the students who have had contact with those who unfortunately are positive. The 6 students who are positive are now in the care of our excellent health workers and medical staff, and they are receiving the best of care so that we can protect them and we can get them out of the illness, sickness situation. I just want to say that everything that needs to be done is being done. Our strategies and implementation plans are all on track, and we're going to do everything to ensure that the students are safe where they are now. Any subsequent decisions, of course, will be taken at the highest level of government and with the advice of our distinguished health experts from the Ghana Health Service. Thank you.
We've been joined this afternoon by Zoom by the President of the National Association of Graduate Teachers, Angel Carbonu. We've also been joined by a concerned parent, Mr. George Boedu Frimpong, and we'll also have a research fellow at the Ghana Center for Democratic Development, who's also a pharmacist, Dr. Thomas Sepang. I'm grateful that all of you joined me. Let me start with you, Dr. Sepang. You've been making projections in the few weeks. Per your observation, what will be your assessment of the current situation?
Well, thank you. I would say that it was quite predictable that we were going to get to this number of about 20,000 as far back as when we went past 10,000. And the reason was because of what we call our doubling rate, which was how long it was going to take for the 10,000 number we had to double to 20,000. And at that time, our doubling rate was 27 days. It subsequently started dropping because our case count started picking up. And by last week, had dropped to 17 days. So it was only a matter of time for us to get to 20,000. But my only caution is that if we don't start working on the causes of contagion and spread in the community, then within another 17 to 26 days, we should be looking at 40,000 minimum. And that is what my concern is, because as for the 20,000, we cannot do anything about it. We probably had the opportunity when we were at about 10,000, and we missed it. I don't think we should miss the opportunity now that we are 20,000.
SHS students who went to school last week are beginning to also bear the brunt of the virus. 6 students at the Girls Senior High School have tested positive to the virus. Shouldn't we have opened the schools?
See, it's like I always say, these things are a chicken and egg situation. Having conversations with the benefit of hindsight are sometimes unhelpful when you are in the middle of a fluid situation. At the time we were opening, we should have looked at the parameters, yes, like I was talking about what was our effective reproductive number, what was our doubling time, what was our average case count on a 7-day run, and stuff like that. We were told that the science was looked at, and based on other intelligence and advice the president received, he decided that the best thing to do was to open the schools. But one thing that was certain about doing that was that if you did open the schools, you were going to cause human movement. And like everyone says, the virus only moves when humans who are infected move. So in all honesty, if anyone felt that reopening the schools was going to be devoid of any new cases being reported, that was a bit naive. There were going to be cases. What we need to see is how badly and what the number of these cases are going to be. So as a test, if you are looking at 6 out of a population of about 800, you would say that the case incidence is quite low. The question is, of the 600 that have been quarantined, what is the percentage that will test positive? That will give us a better picture of how bad or improved the situation is. And until we have that data, I want all of us to err on the side of caution. One thing I want to say, however, is that for parents, as a parent, I can understand the emotional challenges as to being a good parent and being responsible for your children. But having said that, when your child has been a contact, you need to ask yourself, do you want to extract them and further complicate the community spread matrix. That is another difficult thing. So you have to balance parental responsibility against public health prudence. And that's going to be tough.
Dr. Sepang, hold on for me. Let me bring in Angel Carbonu, who is president of NAGRAD. How do you explain the situation that students who went to school just last week are beginning to test positive for the virus?
Well, it could be that student brought some infection from their house. It could also be that that student was infected by another student in the school. It could also be that the student got infected by contacting somebody else. It could be a student, it could be a teacher, nobody knows. So it could be as a result of several factors leading to this situation.
And how are your members feeling, the teachers, after the revelation that one of the teachers also was infected? Mr. Carbonu, if you can hear me, I'm saying that following the revelation that a teacher had been infected.
Yeah, the teachers are very worried. And it is not only teachers from Accra Girls who are worried. I have messages from a lot of teachers from all over the country indicating that due to the health behavior of students here and there, they suspect that the student or that student could be infected, and that until there is a test for those students, they will not be sure, and the possibility of infecting other students and teachers are there, and so on and so forth. Now, there is a teacher in Accra who is infected. What is happening in schools that have not come to the limelight in terms of this COVID-19 in relation to getting infected or not getting infected? So once we have congregated people in a place to engage in an activity, the possibility of spike of this disease is going to be there, and it will be paramount. That is the mistake we are making in this country, that we are consistently and regularly engaging in activities that congregate people at one place. So long as we continue this, then definitely infections are going to spike.
This perhaps confirms your fear, and I remember you mentioned that if you don't feel safe, you will stay at home. Hold it for me. I'll be gauging your mood on that. But let me bring in a concerned parent, George, who's also been talking about the situation. George, you must be worried about this situation, that the children are already testing positive. Okay, so we lost George there. He'll be joining us again. We'll try and get the phone back. But let me go back to you, Angel Carbonu, on that one. You threatened to stay away if you felt that the environment was not safe for you. Is it time yet?
Well, you see, the parents who went to the school premises yesterday and this morning, crying and wanting to find out the status of their children, if they knew this was going to happen, they definitely would have asked their children to stay away from going to school, because they had the option of doing that. But they trusted the system and sent their children to school. So if they had had this on hindsight, definitely they were going to stay away from the school premises, because look, there is nothing more important to us today than life, right? So that is what is happening. Look, politically, we are congregating. To go and register to vote, we are congregating. We have brought students to congregate in schools. So our behaviors is contributing to the increase in infection of.
audio. We're having some feedback from your audio. Let me bring in back Dr. Sepang. Doc, even yesterday, as parents rushed to get their kids at the Accra Girls' School, for instance, it was chaotic because, number one, the place was congested. Number two, the crowd was not properly managed. I bet you some parents or even more students could contract the disease from what happened yesterday. You must be worried about this. Hello, Dr. Sepang. Are you still there, Dr. Sepang? Okay, we lost Dr. Sepang there. We'll try and bring him back. If we have Angel Carbonu there, you were earlier making the point about the environment not being safe. Is it time yet that teachers will withdraw their services because they feel the environment is unsafe?
Countries like Korea, France, and other countries, when there was spike when school reopened, they did not even wait for the teacher unions to raise hue and cry. The government quickly closed down the schools. And we are expecting that the Ghana Education Service and the Ministry of Education will quickly monitor the situation and take their prudent step and advise that, look, life is more precious. We had very good intention for the students and the teachers. The situation is gradually getting out of hand, and therefore we think that the time has come for us to close down the schools.
I guess George Frimpong is back on the line. He's a concerned parent. George, government says it will do everything to keep the children safe. Are you still not satisfied? We have a terrible feedback with George's Zoom. Let me go back to Angel Carbonu. So from now, what will be the decision of NAGRAT as we're hearing? Probably now in Accra Girls Senior High School, I'm not sure there will be any student there if you go there today who are there studying. What is the position of NAGRAT?
We could do this collaboratively with the other unions. That's the Ghana National Association of Teachers, concerned teachers.
Not certified. And I send message to that before the school children, because...
Hello?
Okay, Mr. Carbonu, hold it for me because George Frimpong is back on the line. Okay, George, so let's hear you. Okay, George has gone back again. Angel Carbonu, you may continue with your point.
Yes. So tomorrow, the teacher unions are going to hold a short meeting to assess the situation. And then we'll have to come out with our position. We are gathering information from institutions and schools all over the country. And then we will also come up with our position by the close of work, either tomorrow or on Thursday.
Let me ask you this direct question. There are many who feel the schools must shut down. You agree?
Absolutely, I agree.
All right. So we'll be waiting to hear from you tomorrow after that meeting. You have the Angel Carbonu, who is president of NAGRAT. If we have George Sepang back, George, you must be worried about this situation, but government has assured that it will do a lot to keep the children safe. Aren't you satisfied? We lost George also there. Thank you so much for joining the conversation. And Dr. Sepang is also a research fellow from CDD and also a pharmacist. He joined us earlier.